Excellent. Brianne, I wondered if you could tell us why you chose the child and youth care profession.
I chose child and youth care profession because I was looking for something that would allow me the opportunity to be myself, to work with kids, and be a number of roles in their life. So not just a teacher or not just a social worker. I wanted to be the friend, the confidant, and also in some cases the disciplinarian. I wanted to be the ability to have fun and not only take on one role, and to help kids that maybe no one else was around to help. I had a great opportunity in the college program with the ability to try different things through placements. So I was able to work in a child protection setting, a hospital setting, and as well as a group home setting to kind of feel what my niche was and where I wanted to be and develop new skills that I didn't know I had, or if I had to just strengthen them. I think the ability to listen and really listen, not just listen and nod the head like you actually are hearing what they're saying, but actually hearing what the kid was saying, making sure that you understand what they're saying. And I think for me, just the genuineness that you need, that you can't go in and pretend you care, you actually have to go in and care. Because they know when you're not being honest, they know when you're not being genuine, or when you're just nodding and smiling because that's what your job is. So I think those settings really taught me, and it was the kids that taught me, because they were the ones that would, and they'll tell you you're not being honest, or you're not hearing exactly what I'm trying to say today. And it's through that you actually develop those skills. I currently work in a secure detention center, and I primarily at this point work with female youth. And I've been working with the females for almost 2.5 years now. And they are between the ages of 12 and 18, some are a little older. A lot of programming with them, a lot of self-esteem development, relationship building, and the secure and the custody part of it, where you're providing a safe environment, but also maintaining rules and order within the unit. The best part of my job is seeing the difference that you make. There's often times that, especially with girls, not so much with the males, but with the females, well, they'll actually say, like, I feel safe here, or, you take more care of me than my mom, or I actually feel like I can be me. That to me means that we're doing our job right. That to me shows me that I'm being genuine and I'm showing them that I care, because I actually do. And them understanding that as much as I want to shut my job off when I go home, I still think about them. I still think when they leave the facility. And I think that ties into, having the ability when kids call in just to check up and check in and say, I'm doing okay, or I'm not doing okay, I need help right now. And they still do. And it's, that conversation you have to remind them that you haven't left. The thing with a facility like this, the diverse populations that you deal with, is you have to have an open mind. You have to leave any of your baggage, any of your biases at the door, and have a clean slate. These kids are just youth. They are still trying to figure out who they are. They're trying to figure out what they need in life, and questioning whether it's their sexuality, or questioning, what their role is in the world. It's up to us to kind of nurture that. And whether you agree with what they're feeling or not, that's not our choice, and it's not our place to judge. We're here to help mold them. So being that ear and allowing you the opportunity, or allowing them the opportunity, to talk to you about it, and to just at some points listen, and some points providing them with those outlets that they need, getting them hooked up with community resources, making sure that the right people are informed of what's going on. So when they do leave here, there's hope, and it's not, they don't look at life as hopeless anymore, that there is more to life than what they see, and that a secure setting, a custody setting, isn't what life has to be. There has to be more than that, and to show them their potential, to show them that they're worth actually putting the work in, and somebody actually they're worth caring about, and making sure that they are, aware that they're worth it. I think especially in the female unit, we embrace their bedrooms. This is their place that they can be themselves. So as long as, you know, they're appropriate, I think it's really important that they personalize it. This is their safe place. This is the place they should be able to go and not worry about anyone else. Nobody likes to be, you know, secured in a room for the night, and the reality is that's what we have to do. And so allowing the youth to decorate and to make the space theirs provides them with a little bit of a safety net, so that they know that, you know, this is their space, and you know, yes, we have rules, etc., but they can be okay. They can be themselves in here and not worry about the outside world judging them. Looking back, and if I had to do, you know, a 17-year-old self and prepare myself for the next, you know, 12 years, I think it would be really important to remind myself the genuine. I keep coming back to that because that's what I look at as so important. And giving you the patience, the understanding, the compassion, and also being able to realize that there are times where you can't always be their friend. You're going to have to take a different role. And yes, at that moment, the youth may be so angry at you that they're lashing out, but don't take it personally. Because 3 days later, 4 days later, it might not even be that soon, they're going to thank you for it. They're going to say, you know, because you did that, you showed you cared. And I think it's important to remind yourself that you're doing it because you care. And again, leaving that stuff at the door and realizing that the attacks aren't personal. And there are times where they lash out at you because you're the safest person. And there's times where they yell at you because they know regardless, you're gonna be there the next day and you're gonna welcome them with a smile and you're gonna start fresh. And most of the kids that we work with don't have that. Nobody's loved them unconditionally. And although it's a different role that we have, you can still be there unconditionally. And to just keep that in mind through all the ups and downs.
Okay.
My name is Renee Robinson, Renee Robinson. And I'm a child and youth counselor at the George Hall Center for Children and Families. I've always been interested in supporting youth, adolescents, in emotional, physical care. I geared into mental health when I was a student at the George Hall Center, and I started to see the residential field as not just a house, but an actual treatment center where I was able to work with social workers, psychiatrists, psychologists, and I was able to see the various needs of mental health or youth who have mental health. So that was when I was like, okay, this is the field for me. Supporting them from various things, from waking them up in the morning, from supporting them in finding their goals, working towards their goals. And also I have a deep interest in working with families. Working with families I think is very important in working with them as a whole, not just as individually, and yet you do that as a child and youth worker, but working them as a whole unit. Because when each one teaches one, so I find in the family unit as a child and youth worker, you're able to work with them in that way. Well, as a primary worker, you know, you have your case, and so you have your case that lives in the treatment center, and if they have families that are invested in the process, then you have the opportunity to work with the families. So there is various cases that I've had where I'm able to work with the families, encourage them to attend family sessions, encourage them to work on family goals, able to visit the families in their home. So it's really nice to see, you know, your youth that you work with in their family home. You get to see them in a different light. And that's where their home is. That's where they feel comfortable. They can be themselves. So working with them in those type of dynamics and those type of settings is very interesting. And I think also, you know, as well as residential work is important, but when child and youth workers go into the homes, that's where, you know, a lot of the times where you get to see the real raw issues and family themes in their home. So those are one of the things that I was able to take in as a child and youth worker, is to work with the kids in their home. I'm very grateful for attending Humber College, the Child and Youth Worker program. I was attended there for 3 years and I graduated. And the courses there were set the foundation, really set the baseline for child and youth work, from classes of advanced therapeutic interventions. I had one course that talked about the different theoretical orientations, fair play, interviewing skills. Those were, you know, it really set the practical skills for me as a child and youth worker. I also attended Ryerson. I got my BA in child and youth work, and so university, you know, it represents theory, so I got to learn a lot about theory and how to put it into practice. So I think education in the child and youth work field is very important. It really sets the groundwork for you as a youth worker, but then as you go into the actual work, could be school, could be hospital, could be residential treatment, you know, you get to really find your own. You get to have your own feel of skills to integrate into the work. So yeah, education is very important. It really did help me. Well, I find that depending on where the client is at, it's not the theory that you're going to use, but it's you know, say you have a youth with Asperger's. Some may feel that the behavioral therapy may help, or CBT, you know, cognitive behavioral therapy may help with that particular client. So I had my first primary case actually. She was dealing with a lot of trauma. She experienced a lot of detriment to her sexual and stuff. So I had to use a lot of PTSD with this client. Just going back and, you know, when she was triggered, was able to work with her in that moment and work through the trigger moments with her. So I think that based on the client that you're working with has a lot to do with what theory you're going to use. As I grow as a child and youth worker, I've realized that patience is a huge skill. I think that patience is important. I think being authentic, that was one of the things that I remember from Humber College, is that when you are being authentic, being genuine with your youth, it means a lot more to them. So it could be, skills could be as waking them up in the morning. You know, you need to use your patience with that. They may not wake up, you know, 5 wake-ups later, but you keep on knocking on their door because you know that they need to wake up, they need to go through their morning routines, they need to attend school on time. Another one is, as well as the ability to empathize. I think that, you know, our youth is going through a lot of emotional turmoil, a lot of you know, issues, family issues. Some have experienced a lot of abuse, physical neglect. So just the skill to empathize, not only to understand where they're coming from, but just to demonstrate a willing spirit, a willing heart to say that you're here and that you're here to listen to their story. I think those are the main skills that just pop in my head as a child and youth worker. The best part of my job is that I can just be me. I think, you know, with residential work, you're able just to bring your own beliefs, values, and skills shared among your teams, and it's embraced. Sometimes it's not. Sometimes it's challenged, which is good too, I find, because you get to question, okay, the way that I'm thinking, it's not about being right or wrong, but can I understand where the other person is coming from as well? So, yeah, the best part of my job here is that, or I should say as a child and youth worker, is that I'm just able just to bring my skills, you know, my beliefs and values, share it. Don't feel any type of shame or anything. And just, you know, share it, and if it's embraced, or if it's challenged, that's okay too. But it's always a growing process. It's always about learning about self, learning about other people's beliefs and values, as well as the youth's beliefs and values, teaching them about beliefs and values even as well. But just, yeah, I think it's just bringing each individual gets to bring their own uniqueness to their work, and it's okay, it's accepted. As a child and youth worker, I think it's very important to see when the kid is being successful. It could be as, you know, having 2 out of 3 wake-ups at 8 o'clock, that's successful to me. You know, when the kid is making one little change, one little tweak, little bit of effort, that's when it's success. And it varies from client to client because every client has different needs, right? And they developmentally they're at a different level. Doesn't mean that they're better or smarter or quicker than anybody else. It's just they're working at a different level. So as I was saying before, it's really important to meet your youth where they are at. So yeah, it could be, you know, that they said good morning after 5 weeks of not even acknowledging that anybody's there. So it depends. It really depends. It could be of, you know, getting a credit from school, going to a family session, to those small things, to bigger things about talking about their abuse that they've experienced in the past. Seeing a young male cry for the first time about some of their physical abuse that, you know, that they experienced from their father. So it varies from client to client with success. I just find that I think it's very important as a child and youth worker that it has very little to do with you, and it's more about the kids that you're working with. Yeah, self-care. Gotta take care of self first, because it could be you be working at a residential hospital, child care center. Working with youth can sometimes be tiring, can sometimes be emotionally, mentally draining, and if you don't take that time to really self-care, debrief, then you might get a little burnt out. What I learned from college as well is that self-awareness is to be aware of when you are getting that burnt out feeling, and use your coworkers, use your supervisor, use your professors as a way to debrief and talk about what's been going on for you at work. You know, one of the workers that try not to carry it home, but sometimes it's hard. Sometimes it's hard not to carry it home. But always take the time to self-reflect and to self-care, because it can get training sometimes. But also it's rewarding. Anytime that I talk about work, you know, to my parents or to my friends, they're always just like, you know, it always takes a special type of person to do this type of work, because like, how do you do it, you know? But to me, it's not work, really. Like, it's just something that I'm very passionate about, and I'm willing to do. So.
Thank you very much.
Oh, you're welcome.
Okay, my name's Daniel Harper, D-A-N-I-E-L, and Harper, H-A-R-P-E-R, like the Prime Minister. And I'm a child and youth worker, and for approximately 27 years.
Fabulous. So Dan, I wondered if you can think back to how you chose the child and youth care as your profession.
Well, way back when I had some thoughts about either social work or teaching, and at that point in time I went to Mohawk College in the early 80s, and it was a 2-year course, and I was 25 at the time, so it was kind of a expedient way to kind of get into that realm. And then about 15, 16 years ago, I ended up in day treatment. So every day I work with teachers and youth workers in a classroom setting. So that's kind of the best of both worlds. I'm very pleased with that turn of events. Well, I don't think it's comparable to what kids get now, because it was a 2-year course. And as I recall, the first year you went in for 2 months and then you were out in the field for the next 4. So it was rather quick indoctrination. And it was learning on the spot. I was very fortunate. I had 2 very good field placements with a lot of ups and downs, obviously. And you would go back every now and then to the college and, kind of vent about your experiences, good or bad. One of my teachers at the time was a male, and that was pretty unique at the time too. Was to have and he was the only male youth worker I knew for the longest while, and so yeah, it was rather quick indoctrination. I think the whole deal with the first year placement is to figure out whether or not A, you can do this, or B, you want to do this, because you get hit with some reality fairly quickly. So I enjoy it. I worry that sometimes, as I'm getting older, they're obviously getting much younger. I think they are slightly better prepared. They have a better idea, perhaps, than I did about what this job entails. And if a student is really interested in learning about the job, I got all the time in the world for them. And for the most part, I tell them that some of the learning happens after 3 o'clock. The people, especially over at the school building, there's a wealth of knowledge, not only myself, but everybody's kind of in double digits with years of experience. And if so, I just really look for someone that's really interested in learning. I can give a lot of anecdotal stories about how the field's evolved, and currently right now I'm supervising a male student, which I think is a good fit, and he's a little bit older, and this is my profession, and these are the people that are going to be the future youth workers. So I have a vested interest in making them as ready for the job as I possibly can. That it's radically different than the beginning, that men are in this field and in this field for a career. It's evolved into a career. Back when I began, unfortunately, the male was looked upon as the physical presence, large male, and which I always resented. That wasn't my role or my theory. The clinical work is what it's all about, figuring out kids in regards to their family and day-to-day living. It's kind of a good thing now for males to be in the field. I think if you work with a female, give a nice balance. You never know what kid needs a male mentor, role model, whatever. I think that male or female, clinical skills and learning about the job is what it's all about. Quite frankly, the physical presence is all but eliminated from the field now. I can tell horror stories to kids about how physical intervention was such a big part of the job way back when, and it's not now, which is, again, I think a growth in the field, and that youth workers are looked upon as much more than, muscle or protection, that kind of stuff. Well, I think from the get-go you have to realize that you are a role model from the moment you walk into your place of work, and sometimes that takes a lot of concentration because you have social relationships with people, but you are being watched, and you can't minimize the effect that your presence has on the kids. They may have been lacking, male or female role models in their life, and they pick up a lot from you. And I think that that's something, especially perhaps some of the younger people need to realize, is that from the moment you walk in, you're on with your dealings with kids.
Speak a little bit about the written skills.
Well, this is a big issue with me. I've worked with a lot of young students, or even people in the field, that can do really good work, have some really good ideas, but they lack the ability to convey them, either orally in a team meeting and present with confidence and clarity, and certainly in the written work. And unfortunately, therefore, a lot of the good work gets lost. And the written work is a big part of the job, the documentation. There's enough paperwork involved because we are professionals, and incidents need to be documented, reports with your clinical feedback, and of course where I work, where you have the luxury of every second Wednesday afternoon, we have a team meeting which includes a consulting psychiatrist, a social worker, team manager, and the whole team, including the teacher. And this is a time where everybody's in one place at one time, and that's the one place where you can present your ideas and get feedback and develop your ideas in the meeting. And a lot of times students are intimidated or a little reticent to do it, and I keep pushing them that you're here every day or 3 days a week, whatever it may be. You have thoughts, you have observations. It's not an exact science, and it's also part of the learning process. And a lot of times there's a good learning process after a team meeting where maybe some concept was missed by a student, but that can be clarified. And it's all,